Our first performer, Dr. Adrian Cois, is been involved in countless diagnoses during the COVID pandemic as an emergency medicine physician. He's currently an intern, first-year resident, thankfully only for another month or so, at OHSU, the emergency medicine program. He originally was born in Australia, came here for his medical career with his wife and 2 kids. And he has a story for you about one of the most intense intern years imaginable. Please welcome to the stage, Dr. Adrian Cois.
Thank you for having me. So 3 years ago, I was a volunteer in the emergency department at OHSU. Back then, the majority of my prescriptions included cups of water, sandwiches, and warm blankets for my patients. It was a really valuable time in my life because I was able to learn the value of how these simple interventions can make a massive difference for our patients and building a connection with them. Fast forward to July 2020, I had matched into the emergency medicine program at OHSU, and I was ready to start my career in emergency medicine. It certainly wasn't met with a total sense of ease, because we were right in the middle of the 100-year global pandemic. And if I'm honest, I was fearful. I was fearful for my health, I was fearful for the health of my family, both my 2 kids and my wife. But we were all in it together. I reached out to senior faculty and asked for advice on how we can stay safe, how we can be able to do our jobs and feel like we can push forward. And no one really had any great answers for us. But we came together and we worked hard to keep each other safe and be respectful of everyone's fears throughout this difficult time. I want to tell you a story about what it's like to work in the emergency department. We have such a diverse population that come through the emergency department. We have patients who are worried well, and most of the time they go home just fine. We have patients who are homeless, and they're more often than not looking for a hot meal, a warm bed, and some respite. We have belligerent people who are often intoxicated, and then we have a waiting room full of people that need a diagnosis, and they need a management plan, which sometimes will include acute management in the emergency department, an inpatient stay, or potentially going home with follow-up with their primary care provider. The story that I want to tell you is not probably what you're thinking, some horrific story about a patient dying of COVID, but of a more common story, one that I've seen many, many times throughout the last year. And it's very sad that this is the case. I was working a shift, it was a morning shift in the emergency department, middle of the week. I looked on the board and I saw a 40-year-old female with a presenting complaint of cough. My heart sank. I thought, this is going to be a COVID case. Is this going to be the time that I'm going to get infected? Is this going to be the time that I'm going to potentially bring this deadly virus back to my family where they could get infected? So I did what I needed to do. I went over to the PPE tray and I got dressed. I put on my double mask, I put on my goggles, my face shield, my gloves, my gown. I'd done this over 100 times at this point, so I was pretty much a pro. But across the time of working in the emergency department over here in the US, I had been told off many times about my poor donning technique from my nursing colleagues. So I had good teachers. I went into the room, and what did I see in front of me? I saw a 40-something-year-old female. She was Hispanic. She was sitting slumped in her chair, and she was very tearful and basically forlorn. And me, I looked like an alien, dressed in an astronaut suit. There was an interpreter tablet sitting right next to her, which is something that, although we have wonderful interpreters that we work with every day, it makes it really hard to build a solid connection with the patients because you're interrupted and not able to have a conversation that flows, which we are all used to now when we're working in a virtual environment. I subsequently found out that this patient had had a number of days worth of flu-like symptoms and a cough. Upon hearing this story, I thought, this is the real deal. This is going to be an open and shut case. She is going to have COVID, and I'm going to have to help her through this. So I did the right thing. We got the swabs, we put it into her nose, and we let the test cook. I left the room and went off to see another patient. Coincidentally, the other patient that I saw was also a 40-something-year-old Hispanic woman who came with a cough. So I'll let your imagination try to figure out what was going on there. While I was sitting outside of her room, I thought about why the patient was so upset and why she was so worried. She didn't look that unwell. And then I thought about it further. This is a patient who is recently unemployed. She doesn't have medical insurance. How is she going to pay for this visit to the emergency department? How is she going to support her children while she would need to be isolated and while she wasn't able to work because of her symptoms? And I felt helpless. She was also so worried about her own mortality. And rightly so. At that point in time, the vast majority of patients that I saw who had COVID and severe COVID were Hispanic and Black. So I went back into the room, again, looking like an astronaut, although I'm a human being, after finding out that she had a positive COVID test. I got the interpreter back on the line and went about the difficult task of telling her the bad news. Breaking bad news to patients is difficult even in the best of circumstances. But when you have an interpreter there using and having to communicate with long pauses, it makes it so much harder. I told the patient her bad news, told her some return precautions of when to come back to the hospital, and told her the need for self-isolation. I felt helpless. She started to cry. I wasn't able to comfort her in that way. And I knew that every moment that I was in that room, I was exposing myself to greater risk. But something came over me. I had this instinct inside me. I had to act. So I sat down on the bed next to her and reached out my hand. She grabbed my hand with both of hers and wept. And I sat there silently with her. I feel like in that moment I was able to connect with her as a human being. And I think back to my time volunteering and I understand how important those human connections are. And I'm acutely aware of what's been taken away from all of us over the last 12 months. And I was thinking about something. If we love our neighbour, then we are connected. When we are connected, we are loved. Fast forward to 2021, this current month of May. I'm vaccinated, vast majority of the community are vaccinated. I still see COVID patients in the hospital, or suspected COVID patients in the hospital. But now I go in there with my PPE equipment on and a heart full of love, with an intention of connecting with that person as a human being and respecting them as a human being and giving them that connection that they so much desire. And hopefully, together we can work hard to rebuild those connections and rebuild our community. Thank you so much.